The second wave of COVID-19 has ushered the country into the second phase of lockdown with a few exceptions.
Government will aim at reducing the speed and the intensity of transmission within the next 42 days.
As of 17th June 2021, Uganda recorded 626 deaths, with 42 people dying in a single day, while 1,397 new cases were recorded, bringing cumulative cases to 70,176. 1,015 people are admitted at health facilities. Recoveries stand at 49,327. Experts say that the proportionate of samples tested has hit 17% in Uganda, yet for a country to control the disease effectively, the number has to be less than 5%. Uganda's health system is overstretched and the available oxygen supply is also strained. Currently, the country can produce 3,000 cylinders of oxygen per day, against the consumption which also stands at 3,000 cylinders.
The oxygen is being produced, but the cylinders to distribute it are not enough.
Oxygen is one of the essential medical supplies that stimulate the ability for a patient to breathe. Each cylinder is 6,800 liters of oxygen. An averagely critically ill patient consumes 1 to 2 cylinders per day. This is 6,800 to 13,600 liters of oxygen. A severely ill COVID-19 patient needs 4 to 6 cylinders per day. This is between 27,200 to 40,800 liters of oxygen.
High flow, actually, you will probably need over 40 liters to 70 liters per minute. Then it means that you need almost 11 to 12 cylinders of oxygen per day.
Dr. Charles Olaro, the Director Clinical Service at the Ministry of Health, explains how COVID-19 has claimed the lives of Ugandans.
It causes a lot of fluid to accumulate in the lung, and the lung gets soaked into, is kind of like a wetland. And in addition that the lungs also harden, so even if you are given a very high concentration of oxygen, it's not able to get into the body systems.
Uganda has 3,793 beds to handle COVID-19 patients across the country, 218 ICU, 475 high dependency, and 3,100 standard beds.
Nambole treatment unit, 1,300 standard beds.
This is Mandela National Stadium, Nambole, one of the designated places where COVID-19 patients are receiving medical attention following an increase in the number of COVID-19 cases in the country.
By press time, we left Nambole when more beds are being offloaded from a truck. COVID-19 patients are seen moving around the pitch, gathered, while others collect food. Outside the stadium premises, I am told, relatives do the needful to bring food to their patients. To manage COVID-19, the social behavior needs to change. The high COVID-19 cases are as a reason of complacency, cluster of infections from schools, patients under home care treatment that mix with members of the public. The phenomenon of steaming as a remedy to tackle COVID-19 is being discouraged by medical experts.
Because the virus is deep inside, how does the steam reach to that? And then if you oversteam, there's a risk of you damaging the membranes, and then you become vulnerable to secondary bacterial infections.
80% of the infections remain asymptomatic, and it is only 20% where the moderate, severe, and critical need to be hospitalized.
The escape route is definitely for us to be able to see this graph come down.